gentlemen, welcome to today's program. My name is Zindzi Kibiku. Thank you so much for tuning in wherever you are today. I'm quite excited about today's show. We are going to focus on health tech. And to do so, we're going to take you all the way to Egypt, where we meet Amir Barsoum, the CEO and co-founder of Vezeeta. Amir, thank you so much for your time.
Thank you, Zindzi, very much for accepting me in the show.
Thank you. Amir, you're in a very unique field, health tech. How did you personally find yourself here?
So I'm a pharmacist by education. I think that's the easiest way to get me in the healthcare space. And my entire life I've been in the healthcare space, either at the provider side, consulting, pharmaceutical companies, and now in the digital healthcare space.
So walk me through the birth process of Vezeeta. What inspired you and your partner to come up with such a successful health tech?
So we're from day one, we were very concerned and interested to see what will happen if you help your providers, your medical doctors, and the hospital systems to be automated and to really to have apps in their palms. That's the way they can communicate with their patients and other healthcare workers. And that was the first point. And this has evolved into being more of a patient-centric approach rather than healthcare provider-centric, where the ultimate goal of this industry is to help patients access better healthcare and have better quality of healthcare and affordable healthcare. And that's what we have done. We start to focus on patients, helping them reach out to these doctors. And we started to think of the patients with time into a holistic manner. We started by doctors booking, but then we introduced telehealth, online pharmacy, home visits, and eventually medical records for these patients. The ultimate objective is to help patients access healthcare. And that is in all the markets that we are operating in. So.
Right, and speaking of that, what gaps are you seeing in the market, in Africa's healthcare market? What gaps are there that you are seeing as opportunities?
I think the biggest thing in Africa, in Middle East and Africa, this entire region, and I think the emphasis will be more on Africa, is definitely the number of medical doctors and healthcare providers compared to what you would see in other parts of the world. So the number of the healthcare providers is at staggeringly low rate compared to the rest of the world, which is leading to way more expensive healthcare than what you would see in other parts of the world. I'm talking about as a percent of the GDP per capita. And I think there is a huge chance for telehealth and different digital health opportunities to fix this gap, either by connecting them to where the places where you find healthcare providers are more abundant, to basically connect them with more advanced medical doctors somewhere else. So I don't need to take the doctor and travel him as we used to do before, but I could just put the patient at the doctor, and even a GP or a nurse practitioner from one end to the specialty care on the other end, and so on. So these kind of concepts and use cases for telehealth have a huge potential to solve the issue that we see today in Africa.
Beautiful. And I mean, I know that Vezeeta has a new product, Vezeeta in a box. Amir, what makes this one so unique, and what is it offering clients?
So while you're moving forward, you would look at healthcare systems and the healthcare groups, hospitals, the chains of polyclinics, and the likes. And for those, they don't have the consumer-facing capacities. And we are very concerned about consumer-facing health tech. And patients suffer to access these entities, suffer to create a repeat. Very little patient engagement tools are in the palms of these healthcare systems. So we said, okay, we have built it all, and we're using it for ourselves. why don't we open up the ground and we actually introduce it to other healthcare providers? And it's not only for the marketplace, but also give it to the healthcare provider, white label it with their own names and brands. So they come ahead of the industry with a fantastic technology, fantastic consumer-facing apps that are proven to work, that are helping patients really access healthcare, and they think it helps providers improve their P&Ls and their bottom lines.
Beautiful. And Amir, the fact that you shared with us that you are a pharmacist by profession, and here you are also a CEO, so there's also the business aspect of it. Do you think that the B2B SaaS would help fight the pandemic, what the world has currently been fighting for 1.5 years now?
So the B2B SaaS will, I think it has a quadrant of 4 values. One, it helped these entities get into a very, very big platform where the entity to entity can actually start sharing experiences and could share their healthcare providers and medical doctors in case needed. So a hospital in Kenya or in Nairobi could have a conversation with a hospital in Cairo for any one of them that has a good specialty that could put them in touch with those using the telehealth platforms on that. So I would say provider to provider relation is a very big thing. 2, because we are working heavily with pharmaceutical companies and the suppliers of the industry, so we'll also put them in touch with these entities that come on board with our SaaS model, helping them educate their doctors, giving them different continuous education and upscale their quality. The third is, which is the direct value, is the consumer-facing piece. And the real value of it is not only branding. I think branding comes to number 4, but it's also making sure that the patients are well engaged. They are basically reminded of the next visits, of the lab tests they need to do, how much copay they need to pay, and so on and so forth. So you really get the patient to be part of the game through technology that is very well used and adopted. 4 is the branding. You're doing all of this without losing your identity at the healthcare system or a hospital group or a polyclinic group. So you're keeping this while you're keeping your identity. So you're taking the value of, think about it, the booking.com in its technology, but you still keep your brand identity and your brand value. So that's why you believe there's a huge impact for provider to provider, the education to the doctors, connection with the education of the doctor and the connection to the pharmaceutical companies, patient engagement, and last but not least, definitely is the brand identity of the healthcare system.
All right, and Amir, from a business perspective, allow me to change shifts a little bit and ask you to put on your business hat and ask perhaps, what's the biggest hurdle that you have faced running a successful health tech startup such as Vezeeta?
So I think if I would take a step back, I think there are two hurdles I would always talk about. The first one is your people, hiring the right talent in the right time with the right skill set, the right, the right exposure. I think I would say this is the number one hurdle, of course, because you're as good as your weakest link. So your employees are your really most important pillar in the game. These are the ones who would actually innovate and interact with your clients and with your consumers. So that's definitely the big thing. Also, there's the exodus move where many of the top engineers and top product people and operational people would actually leave Middle East and Africa, going to Europe or the US. So this is even exacerbating the situation to keep them in a track. And I think in the last year or so, because COVID has reduced these kind of moves, we're seeing less of the issue of exodus, but it's a part of the game. The second hurdle is the industry itself. In healthcare, there's a lot of regulations from a legal perspective and others that makes country by country very different world. So the expansion is not as straightforward. So what you need to do in Kenya is different than what you need to do in Nigeria, and it's very different than what you need to do in Saudi and very different than what you need to do in Egypt. So that is also another hurdle that you start thinking you want to play. I'm using a cliche, but it's actually very true in our case. You want to be as global as it gets in your strategy, but as local as it gets in execution.
Wow, as global as it gets
in your strategy.
Wow, that's the first time I'm personally had that one. That's a good one, Amir. I like that one. So, from a CEO's perspective, Amir, do you think investors are paying attention to Africa's tech startups?
I honestly think they do now. I think now investors started to be, again, right? You need some success stories, and then that follows very quickly by fundraising for the venture capitals, and the cycle will start from there. And I think now it's definitely happening. You would see, so Africa has 4 hotspots: Kenya, South Africa, Nigeria, and Egypt. I think each one of them was pretty close to $500 million of investment just in the first 6 months of 2021. So that's definitely a quite significant piece in the healthcare space, in the entrepreneurship and the tech space. You wouldn't have seen that 5 years ago. You wouldn't have seen that at all. So I guess it's definitely happening. Maybe the question would be the size per entity. I think we need more emphasis on big rounds for the big startups, so you can actually take them at scale and become the $1 billion companies or the $2 billion companies. That we haven't seen yet, but I think it's very soon we're going to see many of those.
All right, thank you so much, Amir. Amir Barsoum, the CEO and co-founder of Vezeeta.
Much more on the impact when we come back.
Today's show is Health Tech. We'd love to take you all the way to Nigeria, where we meet Folake Owodunni. She is the CEO and co-founder of Emergency Response Africa. Folake, thank you so much for making time for us.
Thank you. Very nice to be here.
Amazing. Folake, how did you find yourself in this ecosystem? What was your inspiration to get into health tech?
Okay, so that's a great question. Thank you so much for asking. From my earliest memories as a child, I've always been very passionate about healthcare. I grew up in Nigeria and I saw a lot of people in need, and somehow I felt that becoming a doctor was the best way to help people. But after university, I realized that even though a career in medicine would be fantastic, I wanted something with much bigger impact. So I decided to get a master's in public health. And after many years of working in the healthcare sector, as well as in other sectors in different countries, I landed a job at the University of Waterloo in Canada, in an area typically called Canada's Silicon Valley. So it's impossible to be surrounded by so much buzz and hype around technology and not get bitten by the bug. And so after a while, I decided to do another master's in business, entrepreneurship, and technology. And it was as a part of that program that I started conceptualizing what is now today Emergency Response Africa. And that really came from an experience with my son, where several years ago in 2017, I actually had an emergency and had to call for help. But because we were in Canada, I could call 911 and they were able to get to our house quickly in 10 minutes. They treated him and we didn't need to go to hospital. Of course, it got me thinking about our experience in Nigeria and, more broadly in Africa. When there's an emergency, you usually have to get yourself to hospital. There's a lot that could happen on the way. And so many people die from those situations. And so it became really clear to me that there was an opportunity to use technology to solve the emergency care problem that is widely across Africa.
So how would you say, or what would you say is Africa's biggest challenge when it comes to how we manage medical responses?
There are many, many challenges, but I'll talk about the top three. So the first one is just low health literacy in the population. I mean, you don't have to go far to find stories of, oh, if only someone had known what to do in that situation, the person would still be alive today. I think that if bystanders, regular people cannot recognize and at least effectively respond to an emergency when it happens, more people are likely to die. The second one is just the cost of emergency care. Ambulances are expensive. They're expensive to acquire, to maintain, to staff, to equip. And as a continent that really does not have very well managed resources, we don't have the capacity to provide them in the numbers that are required. I like to compare the ratio of ambulances to the population in Nigeria versus in Canada. And based on some research that we did, the ratio in Nigeria is one ambulance for almost 200,000 people, compared to Canada, where the ratio is one ambulance for just 11,000 people. So it's a huge gap. And because of that, we cannot provide emergency response that is reliable and effective. And that brings me to the third challenge, which is trust. A lot of people just don't trust the existing system because it's slow, it's unreliable. And when that happens, most people will choose to take themselves to hospital or find some other way of treating themselves. But the issue is that they don't get the help they need and people are more likely to die. So it really is clear that there are many challenges and the approach to solving them is not going to be just the typical, let's put more ambulances on the road. We need something that really takes into consideration the community, people's perceptions of how to respond to emergencies, and really educating the population as well.
Wow, and Folake, as CEO and co-founder of Emergency Response Africa, how difficult was it for you to seek funding for your startup?
That's always a tricky question. It's definitely not easy to find funding. I think most founders can relate to, or all founders really can relate to the late nights, early mornings, countless pitches, multiple rejections, and of course the few precious wins that make it worth it. And I think what keeps me going personally is the why behind what we're doing. We exist to solve a problem that literally 100% of Africans have either experienced themselves or they know somebody who has experienced it. So as long as the problem exists, we have work to do. And our job is just to figure out how can we do it in a way that is sustainable, profitable, and of course, impactful. So I would say that all of the effort that goes into fundraising, as hard as it can be, is really geared towards that singular goal, and it makes it worth it.
And how did this current pandemic, the COVID-19, how did it test you and your team?
Yeah, that's a really interesting one. COVID, it's been, I think with a lot of companies, it's been twofold. On the one hand, as a startup that was in the process of looking for resources to really officially launch our product in Nigeria, it had a negative effect where we had certain funding sources dry up. But then on the positive side, we had other funding sources open that were more dedicated towards health tech. And so that, I think, gave us a lot of opportunity to access the resources that we need, as well as the support. So beyond finances, the market access, mentorship, things that have really helped us to move forward. The other thing I'll say is that, COVID-19 has driven the need for more ambulance transfers. And we see some of that on a regular basis in our business, where a patient needs to be moved, whether from home or from a hospital to an isolation center, and they require certain precautionary measures in order to be moved effectively. And so as negative and challenging as COVID-19 has been, it has also driven some parts of our business, which is positive.
Okay, so you've shared with us that you're a public health worker. What are some of the key business lessons that you have learned that you can pass on or mentor to other people?
I would say the first one is a lesson that applies regardless of what industry you're in. And that's simply stay the course, persevere. Or as a friend put it, whatever you do, don't die. And, I would say that for us, it took nearly 2 years from the point where we first came up with the idea to the point where we could actually launch in market. And from, that initial point to when we launched, there was a lot of work that went into putting together the concept, pitching to different people, trying to get the resources that we needed to actually launch, and getting validation that this was indeed a problem to solve. At so many points in that 2-year period, we could have stopped and turned around, but I'm really grateful that we didn't, and we decided to just stick it through. I think the second one is one that I'm still learning, which is use your network. People always say, your network is your net worth, and it's true. Emergency Response Africa could never have existed or gotten to the point we're at now without the complete abundance of support that we've had. So from my co-founder to family and friends, mentors, colleagues, classmates, interns, you name it. Like, so many people have had a hand in getting us to where we are today. And I know that so many more will have a hand in getting us to the future. Everyone has played a role, and we wouldn't exist without it. So what I would say is definitely lean on your network. Entrepreneurship can be very lonely. You don't want to do it alone. Definitely take people with you. And I think those two things, regardless of what industry you're in, whatever your profession is, those are two things that can really help, get us towards success.
Folake, are governments and investors paying attention to Africa's health tech space?
I think the answer is obvious. I would say yes, especially on the investor side. And I would say that the COVID-19 pandemic has forced all of us to take a look more closely. I think we all inherently knew that our healthcare systems were underfunded, poorly structured, and just generally struggling. And I think the COVID-19 pandemic has fully exposed that. And what it's meant is that more people are investing in the space. People are seeing the potential. I love that people are talking about Africa as a market. So it's not just Nigeria. And that's why our name is Emergency Response Africa. For us, the issue is not just a Nigerian issue. It's something that affects Africa as a whole. And what we hope to see more of is more of that long-term investment. So not just the funding, but also the mentorship, the support that's required so that health tech startups can continue to grow and thrive and solve important problems. And from the government perspective, really setting up the regulatory environment to support that. There are so many opportunities, but without that enabling environment, it's going to continue to be very difficult.
Folake, congratulations to you and your team. You were chosen, or rather Emergency Response Africa was part of the 15 startups by Google for its Startup Accelerator Africa program. So congratulations to you and your team on that. So my next question would be, how are you planning to scale up Emergency Response Africa?
Yeah, that's a good question. So we started in Lagos, Nigeria. And one thing that's been really exciting has been seeing our network of first responders, ambulances, and hospitals start to grow even outside of Lagos. And that's been very valuable because it's positioned us to be able to work effectively with health insurance companies that have people all over the country, as well as corporate organizations that are engaged in operations in different parts of the country. What I'm excited about is that in the next, I would say 3 to 5 years, we're going to be in various markets across Africa, not just in Nigeria. I like to share that my co-founder, our CTO, is from Ghana, and she lost a family member because they couldn't get an ambulance in time. So this is not an issue that's restricted only to Nigeria. We very much intend to cover West Africa and start to look into other parts of the continent as soon as possible.
How different are markets, though? I'm sure what you're trying to do in Nigeria may not apply in Egypt or in Ghana. In South Africa, in Nairobi, Kenya. Is dealing with different markets making it giving more of a challenge rather?
Absolutely. I think there's no market that we're going to go into without doing the appropriate on the ground research. And I think that's something that you learn or you should learn very early on as an entrepreneur, is that even when you first conceptualize the idea, there are certain types of research and market validation that you need to do to confirm that your goal is actually going to solve the problem that you intend to solve. And I think for us, even what Emergency Response Africa is today looks very different than when we first conceptualized it 2 years ago or 2.5 years ago. And I trust that, even as we go into new markets, we'll find that perhaps the cultural perception of what we're doing will be different in one market compared to the way people see it in Nigeria. Or maybe they're just, some countries don't have any ambulances, and so we're going to be focused on the supply versus others that actually have a good supply, and it's really more the coordination with technology. So I don't doubt that all of the markets are going to have their own uniquenesses. I think our commitment is to making sure that we understand what each market needs before we go in there.
Folake Owodunni, she is the CEO and co-founder of Emergency Response Africa, joining us in Nigeria. Thank you so much to everyone who watched our program. My name is Zindzi Kibiku.